Hello everyone. So today we're going to discuss lupus erythematosus as one of the oral mucosal diseases, and it comes under the category of non-infective stomatitis. So to understand the oral manifestations of lupus, first we should know a little bit about what actually is lupus. So it is a chronic autoimmune disease, which means it might persist for a long time, and it is caused or initiated due to the immune response of the body against its own cells and tissues. So this immune response of the body can be triggered due to the genetic susceptibility of the person, due to hormonal factors or environmental factors. In hormonal factors, women are more susceptible because of the hormone estrogen. It is said that estrogen is the responsible hormone for triggering this immune response of lupus in a person's body or a female's body. For environmental factors, the UV light can act as a trigger, or a few drugs, etc. Now, lupus in a person's body persists in two forms. So these forms could be either the discoid one or the systemic one. So discoid one, also called cutaneous one, is localized, and the systemic one is more disseminated and it's spread throughout the body. So for the discoid and cutaneous type, it affects only the skin and the mucosa, and for the systemic type, it affects almost all organs of the body. Now the discoid or the cutaneous is the form which has majority of the oral mucosal lesions. For the systemic type, the oral lesions are variable. That is, they may be present or they may not be present. Now, if lupus in the body is manifesting some oral lesions, now what kind of lesions are there? So these lesions could be unilateral, which means that they are present or they might be present only on one side of the mouth, and they persist as white and red areas. Now, if the person is suffering from discoid type of the lupus, then their oral manifestations and their oral lesions will involve white striations along with atrophic and erosive areas, hence the white and red areas. This will include the thinning of the epithelium. In some areas, there will be destruction of the epithelium. Now, this ulceration, especially for discoid type, is surrounded by a white keratotic border. Okay, here you go. And what side of the oral cavity is most affected by this oral lesion? It is the cheeks of the mouth. Now, if a person is suffering from the systemic type of lupus, then their clinical presentation of oral lesions would simply involve some erythematous patches on buccal mucosa. Now, other than buccal mucosa, they can also affect the vault of the palate. Now, just a few points about the pathological changes of lupus oral lesions. Firstly, there will be epithelial atrophy, which means that the epithelial will reduce in its size in these areas. There will be acanthosis, which means that there will be thickening of or overgrowth, in other words, of the prickle layer of the epithelial cells. Now, these lupus oral lesions, they result in a positive PAS staining. PAS staining is periodic acid Schiff staining, and it is used to detect the glycoproteins and the proteins and saccharides, etc. in the tissues. So it turns out positive in these lupus lesions because there is an accumulation and abundance of immunoglobulin protein, which is your IgG antibody, in the basement membrane zone of these lesions. And last but not the least, there is also liquefaction degeneration of the basal layer of these epithelial cells of these lesions. Here you have this degeneration here. Now, Now, how can we diagnose lupus? So, from a dentist perspective, history is the most important here, because history and examination both. Because the patient during the history will tell the clinician himself or herself that they have already been diagnosed with this condition. That will help you in diagnosing these oral lesions. Why are they happening in the mouth? That will make it easier for you to understand and conclude. Other than history and examination, the antibody test can prove to be very vital, which obviously can be done by the physician. And in these antibody tests, there are anti-nuclear antibodies present and detected in the body in case of lupus. And some other hematological test can be done, and in conditions of lupus, they will show conditions like anemia, increased ESR, or leukopenia, etc. Now, once it has been established that the person is suffering from lupus, how do we manage it? So there is a bunch of topical corticosteroids that can be used on these lesions to prevent the inflammation or the pain in these areas, in combination with a few mouth rinses, including the fluoride rinses. Now, in some cases of lupus, Sjogren's syndrome also developed in these patients with the passage of time. And Sjogren's most important manifestation is the dryness of the mouth and the other bodily fluids. So because of that dryness, we need these fluoride rinses to prevent it. Other than these, we can use the systemic corticosteroids, and immunosuppressive drugs are also a part of management of lupus. Now, last but not the least, a few differential diagnoses to be kept in mind for lupus. Firstly, it's the lichen planus, obviously. If you recall the clinical presentation of lichen planus, it is somewhat resembling the clinical presentation of lupus, hence lichen planus, white striations, so leukoplakia as well, lichenoid reactions as well, and the combination of the white and red areas because of that. Erythroplakia is a very good differential diagnosis. And last but not the least, malignant ulcer can be a differential for, because there's always a possibility of malignancy, so can be a differential for your lupus oral lesions. So that was all about the oral manifestations of lupus erythematosus. I really hope I've covered everything and it helps you in remembering and while studying lupus. If you have any questions, please write in the comments box, and if you want me to cover any other topic, do also write that. Thank you so much for watching.